Hi, everyone, and welcome to today's webinar, Investing ARPA Funds in Behavioral Health Crisis Response. We're excited you are joining us today, and thank you for spending part of your day with us. I'm Chelsea Thompson, a Justice Program Manager here at the National Association of Counties. This webinar is part of a series of NACo webinars and briefs focusing on the behavioral health care continuum. Through national initiatives such as Stepping Up, MacArthur's Safety and Justice Challenge, Data-Driven Justice, and other justice reform efforts, counties are implementing programs that prioritize a health-centered approach to support community members with behavioral health conditions rather than relying on jails or emergency rooms. By developing these programs and practices that support residents before, during, and after a behavioral health emergency, counties may achieve their priorities as part of these initiatives. In March 2021, the American Rescue Plan Act provides $65 billion in direct, flexible aid to every county in the US. Counties are leveraging this funding to support community members by investing in health, human services, children and family, transportation, infrastructure, workforce, and employment programs, among other areas. These funds can be used to support new or enhanced services that meet the behavioral health needs exacerbated by the pandemic, such as mental health and substance misuse treatment, hotlines or warm lines, crisis intervention services, and overdose prevention. To get a sense of how folks on this call are leveraging ARPA funds for this priority area, a quick poll will pop up on your screen, and it will ask the question, is your county or jurisdiction dedicating ARPA funds to behavioral health programs and practices? Right now, our options are yes, not currently, or potentially in the future. If your county or jurisdiction is using ARPA funding for behavioral health programs and practices, I invite you to put a brief description in the chat box so we can learn more about the innovative programs you're implementing in your communities. And I'll give you all a few seconds to answer this poll. Great, just a few more seconds. And let's go ahead and close this poll. We can see our responses here in a second. Great. So a nice mix of what folks are doing on this call. It's really great to see that a lot of folks are currently doing it or hopefully using these funds in the future. So it's great to see all the work that you all are doing. Today, we have representatives from 3 counties who are using ARPA funds for this purpose. First, I'd like to introduce Director Latrina Foster. She is the Director of the Department of Behavioral Health in Fulton County, Georgia. Director Foster, thank you for joining us today. Director Sarah Hoyle of the Department of Human Services in Lancaster County, Nebraska, will highlight the work the county is undertaking in this space. Director Hoyle, we're excited to learn more about your work. And lastly, Deputy Director Jewel Denny of the Bureau of Mental Health Services in Allegheny County, Pennsylvania, also joins us. Deputy Director Denny, we welcome you to this conversation. Before I turn it over to our speakers, some housekeeping announcements. This session is being recorded, and the recording, as well as the materials shared today, will be available on the NACo event page within the next few days. Please feel free to send your questions for our speakers using the Q&A chat box, which is located at the bottom or side of your screen, depending on the layout. And now I'll turn it over to Brett Mattson, the Associate Legislative Director for Justice and Public Safety at NACo, to provide an overview of ARPA and how counties can deploy these funds to meet the behavioral health needs of community members.
Yeah, thanks, Chelsea, and good afternoon, everyone. It's great to be on with you, and quick thank you to all of our panelists for taking the time out today to speak on what their counties are doing to use some of these American Rescue Plan dollars in the behavioral health space and to address some lingering concerns in that area. So I'm going to quickly cover just a brief overview of the American Rescue Plan, particularly as it relates to the state and local fiscal recovery funds that hopefully all of you have received the first tranche of and are either deciding on or have decided what to spend those different funds on. And so I'm just going to do a quick breakdown of some of those eligible uses, particularly as it relates to the behavioral health care space. So if we could go to the next slide, Chelsea. Before I kind of really dive into it, I'm not going to really cover much of the mechanics of accessing or reporting on the ARP funds. NACo has done a number of different webinars and different sessions at our conferences around ARPA reporting and things like that. So what I would encourage you all to do is if you do have further questions, about any of the eligible uses or where to access more information, this is going to be your go-to page here. It's the NACo COVID Recovery Clearinghouse on our website. I'm sure we'll be able to include that in either the chat or in the recap after this. But you'll see there the state and local fiscal recovery funds tab. That will be your catch-all for any and all questions as it relates to the American Rescue Plan and how you all can use some of these dollars. There's a function in there where you can put in specific questions about your county. We send those off to Treasury once a week. And so we're upwards of 2,000 questions that we've passed along to Treasury at this point. So I would encourage you all to look there for any additional resources. And on to the next slide, Chelsea. So I'm going to break this down in kind of 3 buckets of behavioral health care and eligible uses. So the first of those being kind of just those broad categories in which you all are able to use some of these funds. And so just kind of running through the list here, I want to point out a couple in particular of eligible uses in this space. The first being behavioral health facilities and equipment. This is something that we've heard a lot from our folks on and questions as to whether or not it's eligible to build a new behavioral health facility or to expand on a behavioral health facility. And the answer is yes, that is an eligible use and something that we have been encouraging a lot of our folks to examine, particularly as it relates to diversion away from the criminal justice system and examining those different practices of where folks are ending up. And so that individuals suffering from some of these behavioral health crises and are not just relying on being in the jail. And so thinking through opportunities to evolve some of those capabilities at the local level. The second one on this that I would really wanted to highlight is the second to last bullet there, which is about the 988 National Suicide Prevention Hotline. So this is something that is coming down the pike rather quickly and something that we want to really emphasize that our folks should be investing or thinking about investing some of these funds in and looking at whether their current systems are able to adapt to 988, and if not, how some of these funds could be used to leverage those that soon to come mental health hotline that'll be coming later this year. So wanted to point those 2 out. Obviously, there's a number of different eligible uses, but just wanted to highlight those 2 quickly. On to the next slide, Chelsea. So the second kind of bucket is this violence intervention and criminal violence prevention that the Biden administration has really taken an emphasis on. And so one of the key eligible uses in this space is to use these funds for different evidence-based practices that will assist in reducing the number of violent crimes that are taking place in your local jurisdiction. So in particular, this includes wraparound services such as behavioral health therapy, trauma recovery, job trainings, things like that. So folks are not ending up right back into the cycle of recidivism that we always kind of emphasize. So a number of different opportunities to address different violence intervention programs at the local level that these funds can be used for as well. And then the next slide. And so the final kind of overview in this category that I wanted to talk about is capital expenditures, which is what I briefly touched on the first slide. And so this is all about construction or improvement of physical buildings when you boil it down. And so these monies can be used for COVID-19 testing sites and laboratories. Additionally, the building of or maintenance of or revitalization of different behavioral health care facilities. Also thinking through whether or not some of those facilities need upgraded ventilation to help to mitigate against the next potential COVID threat and opportunities like that. So there's a number of opportunities as it relates to capital expenditures that these funds could be spent on in terms of growing the possible ability of your county to have a behavioral health unit or a separate facility. So those funds can be used in that space. And then the final slide, I'm happy to take questions after everyone has presented, as I know that's kind of the main point here is that folks can hopefully hear from some of our counties on what they're doing. So just want to say thank you. And if there are questions, I'm happy to take those at the end. I'll turn it back to you, Chelsea.
Great. Thanks, Brett, for the overview of ARPA funding and how it can be used to support behavioral health programs and practices. Now I'll turn over to Director Foster to provide a summary of the ARPA investments in Fulton County, Georgia.
Thank you so much, Chelsea. Thank you everyone for taking the time out to hear what Fulton County is doing and how we will best utilize our ARPA funding to increase our access to care. Next slide, please. We started out by asking ourselves a few questions. And of course, we always want to look at what problem are we truly trying to solve in Fulton County? Who are we trying to serve? And then of course, how can we do it? And then where will we be able to provide this service and when can we get it done? Next slide. So as we look at the continuum of care as it relates to behavioral health, so that's going to include our mental health population as well as our substance use disorders, we know that there are barriers to treatment. And so as we highlight the barriers to treatment, we recognize that there are access to those services within Fulton already. So therefore, let's look at the next part of our continuum of care. So we look at where we are around prevention strategies, increase in awareness, community awareness. We have a lot of school-based programs to educate our youth on mental health and substance use disorders, as well as adults. So we skip that bucket. We look at the outpatient services. We provide a robust array of outpatient services to include individual, family, group counseling services to ensure that people have access to that 8:30 to 5 service. The next array of services would be your more intensive outpatient services, where you have your assertive community teams, your IFI teams, intensive family intervention for children and adolescents, your medication assisted outpatient treatment. We recognize that there are those services within Fulton County. Of course, those services could be increased and a little bit more robust, but they are available. But when we went further down the continuum, where we realized that we have a lapse in service, where we could focus our energy would be around being able to respond to an individual in crisis. As we know, our outpatient clinics, since we do not provide within our array of services intensive outpatient, not everyone is going to fall into the category of needing services from 8:30 to 5. So how could we best address an individual that's experiencing a mental health or a substance use disorder crisis outside of the scope of what we currently do? So what we've decided is that is the category that we're going to focus on. We don't want to go to the very end of the continuum, which is commitment. How do we prevent that from happening? We're already situated. We're able to do our prevention. We're able to do our early intervention services with education, increase in awareness in the community by having community conversations, series of conversations around mental health and substance use disorders. We have our outpatient services. However, where we see a gap is our crisis services within our county. Next slide, please. So what we've decided is that we could utilize our ARPA funds to serve two populations, not focus on one, focus on two. So our end goal is to ensure that adults and adolescents that are experiencing a mental health crisis have access to crisis care. And so we would like to provide crisis services to individuals that, to two populations, our adults and our adolescents. In addition, we also would like to provide detoxification to adults and adolescents as well, and also provide outpatient services in the same location. So how will we reach this goal? Next slide, please. So what we've decided is that our end goal is to expand access to care, especially care when an individual is experiencing a crisis. We want to prevent suicide, as we all see that our suicide rates are increasing. How do we implement a service that will prevent suicide? We also want to alleviate the pressure on our regional emergency rooms. People are typically diverted to the wrong place when they are experiencing a mental health crisis. So in response to that, what we would like to do is to provide a 24/7 access to mental health crisis services by opening up what we call in Georgia behavioral health crisis centers, where we provide access to 23-hour observation, as well as if the 23-hour observation does not meet your needs, you will have access to a longer length of stay where you can be wrapped with services, and those services are provided by, of course, our medical and professional experts in the mental health and substance abuse arena. You can go to the next slide, Chelsea. So what we realize is that we have this beautiful facility in Fulton County where we currently provide outpatient behavioral health services. to children and adolescents and emerging adults. We decided we could take this facility and convert this facility into a behavioral health crisis center. The facility is approximately 48,000 square feet. It has 2 separate wings. And so we did an estimate to determine how could we best utilize our ARPA funding. We looked at 2 different models. We can either do a renovation of this current space, or we can do a new build on the property. The property is approximately 28 acres of land. So we have the capacity to either build a brand new facility on this property and or do a renovation of the current facility. Next slide, please. Thank you. And this is just an area overview of the campus and what it looks like and the scale of the facility. It is a huge campus where the potential is great. Next slide. And so I don't know if people are into reading conceptuals, but this is just a conceptual to give an idea of how we could take the current facility and create these crisis stabilization units where an individual can stay in a crisis stabilization unit for days until they're stabilized, and also offer space for the detoxification for those that are experiencing a substance use disorder to make sure that they go through medically monitored withdrawal management. So we allocated spaces where a person would have their own private room. And then we have our location where we would have our nursing station. And then down at the bottom is the area where we designated as our observation unit. So an individual could be dropped off by an emergency responder. They would remain in the facility. We would provide 23-hour observation. After that 23 hours, if we determine that they need a higher level of care, then we can just transition them right over to the crisis stabilization unit. But both options are available. Our end goal is to also ensure that we have wraparound services within the same facility so that people have access to a continuum of care once they are released from our crisis stabilization unit. And I say crisis stabilization unit because we have, as a part of a behavioral health crisis center, you have the 23-hour observation section of your behavioral health crisis center. And then in addition to that, you have your crisis stabilization unit where an individual can stay 7-8 days if they need to until they become stabilized and safe to transition back into the community. Next slide, please. And something else interesting on the current campus that we also have a huge gymnasium, which is labeled as D. And so our thinking is that let's conceptualize this campus further down the line. And so as we look at D, we were thinking about taking that gymnasium and converting it into a diversion center if needed in the past, because the county in a partnership with the city of Atlanta to open a diversion center so that individuals are diverted from jail and connected to necessary resources. But in the future, if we have to identify a new location, we have identified a new location where we can provide that service as well. And that is the end of my presentation. Thank you so much, Chelsea, and I will be around to answer any questions.
Great. Thank you so much, Director Foster. That was so fantastic to learn more about what you all are doing in Fulton County. And next, I will turn it over to Director Hoyle to talk about the work that their county is undertaking in Lancaster County, Nebraska.
Okay. Thank you, Chelsea. Good afternoon from Lancaster County, Nebraska. Hopefully it is warmer in your county than it is here, where it's 5 below today. Thank you for taking the time to learn more about what we're doing in Lancaster County. And just to give you kind of an overview of our county, we have a population of about 300,000. And early on, when the county received $62 million in ARPA funding and the city received $46 million, our elected officials decided at that point that they really wanted to work together from the city and the county to prioritize what they were going to do with their ARPA funding. So they decided on different priorities that they wanted, and in human services, they came up with 5 different focus areas. And those focus areas were youth crisis response, which I'll talk more to you about today, racial equity, youth and adult behavioral health, basic needs, and then victim safety and violence prevention. So they allocated a total of $21 million in ARPA funding for these different focus areas. For racial equity, youth and adult behavioral health, basic needs, and then the victim safety and violence prevention, we put an RFP out for our nonprofit agencies to see essentially how they would respond to these 4 priority areas in our community and what services they needed assistance with. Go ahead and, yep. Okay, so as far as youth crisis response then, this was one of the more difficult areas of those 5 focus priority areas, because this really involved identifying a new service and then building it up from the ground up. And as most communities during the pandemic, we saw an increase in our youth suicides, our youth crisis calls to police, and calls from parents into our family helpline. And when we really started looking at the data around this, we saw a lot of these calls coming in for help were callers that had never called before. So new people seeking help, seeking assistance for their children. Also similar to most communities and very similar to Fulton County too, it sounds like, is our jurisdiction lacked immediate crisis services and respite services as well for our youth population. We found that kids were finding themselves in detention, waiting there for a number of days, sometimes a number of months, for different behavioral health services. And we knew that this was something prior to the pandemic, but as most gaps in services, this really exacerbated during the pandemic, and we saw the need grow. So when we were coming together, oh, you can go back. Sorry about that. Yep. When we were coming together to really talk about our plan and how we were going to move this forward, there were 2 different things that we really wanted to get from the youth crisis response. And we wanted the short-term 2359, just what we had heard from Fulton County for families, but then we also wanted an avenue or a pathway for children to be able to seek inpatient services too that needed it. And this was something that we consulted with an outside consultant to come in to really work with our community, because while we had the ARPA money up front, what we wanted to make sure of was that we had a sound, sustainable plan to carry this on into future generations. And so one of the things we knew we had to do from the beginning was really create community buy-in from stakeholders, but then also from the ground level, from the community. So we conducted a number of focus groups within the community of children, of families, and then just of nonprofit agencies and community members on what they really needed. The other takeaway I would say from this is we really learned that we needed to make sure we were all speaking the same terminology. And around that, we needed to make sure we had the same vision and mission going forward with what we were really trying to develop. And let me give you an example about the shared terminology. We wanted something that there was no eject, no reject policy. But when you say that to private providers, or when you say that to individuals actually that are providing the service, they get really scared with that. So we knew that from the get-go that we needed to come up with terminology that we all agreed on, but that we had common definitions for as well. So, okay, go ahead. All righty, community-based support through our ARPA grant solicitation, and I'd be happy to provide you with, if you're thinking of doing RFPs with this funding for nonprofit agencies, with the grant application that we use. But essentially, we pulled our questions right from the interim rule, what they were seeking, and we asked that of our nonprofit agencies who were applying for that. And then we had set up review of 3 different stages. It was we had an internal review internal review panel, and then we had our elected officials review it, and then it went to our board for approval. And final slide, please. And then the last thing too, with all 5 of our focus areas, we partnered with the university to collect data so that we could make sure that we had all of the reporting requirements in place when needed. So.
Great, thank you, Director Hoyle.
Sure, thank you.
Thank you, Director Hoyle. It's great to hear about all the work that you all are doing, especially the community buy-in and the work that you're doing around that space. And now I will turn over to Deputy Director Denny in Allegheny County, Pennsylvania.
Hi, good afternoon, everyone. I'd like to thank Chelsea and the National Association of County for having Allegheny County represented on this panel. And today I'm going to focus on 2 areas in which we will invest our ARPA money. one being mobile crisis expansion and one being the peer-run respites. Just to give you a little bit of background on Allegheny County, we have over 1.2 million residents living in 130 self-governed municipalities and relying on over 100 police departments. So, you know, each community that you travel to looks very different. And as you see there, we also have 43 school districts that make up our county. Today, we have over 1,600 individuals in our county jail, 67% of who are Black, while only representing less than 15% of the county's population. Clearly, you know, disproportionately overrepresented. We also know that almost 70% of individuals in our jail have received at least one publicly funded human service within the prior year to their entry into the Allegheny County Jail. Next slide, please. Here in Allegheny County, we have an integrated Department of Human Services, and that department includes the offices of Children, Youth and Family, Aging, Developmental Supports, Community Services, and the Office of Behavioral Health. In 2020, these offices combined served 1 in 5 Allegheny County residents, and over 59,000 of those individuals received a behavioral health service. So just to also give you a little bit of an idea of our psychiatric beds in Allegheny County, there are approximately close to 400 beds, and on any given day, over 300 of those beds are filled. Next slide, please. In 2008, Allegheny County, you know, had implemented a crisis continuum. And that crisis continuum consisted of telephone, mobile, walk-in, and residential services, which we know here as Resolve Crisis Services. Resolve employs over 130 staff, including peers, psychiatrists, nurses, and clinicians that have consistently provided over 100,000 of crisis services per year since its inception. And you can see here on the slide that typically it's over 100,000 telephone contacts. 2020, we saw just shy of that with 67,000 calls coming into the center, and then over 30,000 calls going out from the center. And basically those calls that are going out are from peer supports and specialists who are reaching out, doing follow-up calls and linkages to those individuals. Our residential crisis services are, you know, it's up to 3 days that an individual can stay there, more if needing more stabilization. The walk-in is very low barrier. It, as you know, others have stated, is the no eject, no reject. And yes, that does cause some concern for providers, but luckily here in Allegheny, we have a great partner in Resolve. And, you know, they open their doors to anyone who's knocking on them. And then with our mobile crisis, over 9,000 calls within all of our communities in Allegheny County. Next slide, please. Although, you know, Resolve's volume is quite impressive, often emergency services such as law enforcement and hospital emergency rooms become the primary responder or the first stop for individuals who are experiencing a behavioral health crisis event. And we all know that that's not what we want. As you know, and what we found, and what you will see here, is that in our communities of color, we're seeing the highest rate of 911 calls in response for behavioral health crises. What we have done here in Allegheny County, in September of 2020, Allegheny County Department of Human Services and Allegheny County Emergency Services co-convened the crisis response stakeholder group to address the over-reliance on emergency services for people experiencing behavioral health challenges, as well as to address the racial inequalities that we're seeing throughout our systems and our crisis system. This group consisted of 30 stakeholders, and those individuals were police, client and family advocacy organizations, human service providers, the health department, Allegheny County's behavioral health managed care organization known as Community Care, mayor's offices, and others. And community members were also engaged and provided input and feedback to this group through a survey that was available to all. And most importantly, this group created a shared vision, and that shared vision was to build trust with our communities of color, have fewer people in active crisis, not have law enforcement as the first or the only response to behavioral health crises, not view jail as a primary method for connecting people to the behavioral health system, and most importantly, that people are aware of and have more and easier access to structurally competent, culturally humble, trauma-informed crisis services. So this group went on and identified gaps and opportunities within our system and developed a set of 16 recommendations. And these 4 recommendations that you see here on your screen led us to focus really on the 2 areas that I will discuss later today with you all, and that is mobile crisis expansion and peer-run respites. I want to thank you, and I look forward to our time together today. Thank you.
Great. Thank you, Deputy Director Denny and Director Hoyle and Director Foster for all these great perspectives. It's so awesome to see your county's using ARPA funds for different pieces and elements of the behavioral health continuum of care, and how we can support community members who have behavioral health needs and conditions in the community and connecting them to the folks who can support them. So I know we've had a few questions come in from the audience. If you have questions, feel free to drop them in the Q&A. I have some questions for our panelists that I'll ask first, and then we'll turn it over to the questions that come in through the audience. I really appreciate how all of you talked about how your county decided to use these ARPA funds for behavioral health programs and practices. Is there one specific factor or a slew of factors that really highlighted this issue area as a priority in your county?
I think.
Go ahead, Director Foster.
I think for us, it was looking at the gap in service and wanting to ensure that our county was ready for the aftermath of COVID, is what I like to call it. Because as we were going through COVID and still going through COVID, we saw an increase in a lot of alarming areas that were related to behavioral health. And we always knew that we had the gap in ensuring people had access to crisis stabilization services within our county. So this just kind of pushed us forward to ensure that we position ourselves to be able to answer the call.
Hi, I'd like to add here in Allegheny, I talked about that crisis stakeholder group and those 16 recommendations. And this really gave us an opportunity to act upon and deliver some of those recommendations that we heard. In addition to those recommendations, I had mentioned that a survey was available to all residents of Allegheny County to react to and provide feedback on each of the 16 recommendations, and actually allowed them to identify the top 5 that they saw as a priority. So we had a great response rate to that survey. We also conducted listening sessions with individuals who had lived experience and had utilized crisis services themselves. We had listening sessions with frontline staff at both our behavioral health, our crisis and homeless agencies, And we also had some listening sessions with law enforcement officers across the county. So this money is really allowing us to do what the community has been asking for.
And for us in Lancaster County, this was something that similar to what has already been said, we had a community needs assessment that was already completed. And then after we saw what the pandemic did to a lot of our children and the needs of families, this allowed us to go forward with what the needs assessment recommended.
Great, thanks for all that insight. Have you experienced any challenges so far as you're starting to ramp up using these ARPA funds for this priority area, and how have you overcome them so far?
Hi, so we definitely have experienced challenges. I would say the biggest challenge that we are experiencing currently, which I'm sure we all are experiencing, is the workforce shortage. And providers having the bandwidth to actually, expand programs and implement new programs. So, as we're moving forward here, we've really invested a lot of our monies, not from the ARPA necessarily, but from our BIMCOs and reinvestment funding to really help solidify the provider workforce. And offer bonuses and things to individuals. Of course, one of our concerns is that how do we sustain that, right? So one of the things that we're doing right now is we really are looking at our providers and encouraging them to identify those services in which we could look at rate increases, so that they can increase the salary of these, staff that are providing these most critical services.
I would say for Fulton at the current time, we have not experienced any barriers, and that's because we are still in the design phase of our project. But as we forecast, we know that the Great Resignation will be a barrier. So I may be reaching out to Allegheny.
And I would say for Lancaster County, sustainability as well. While we have these funds up front, really seeking defined commitment from stakeholders. That's why they were at the beginning of the planning process with us. But then also some of the supports that we want to put in place for families aren't, there's no terminology, no service definitions written around them. So developing a new service definition that is reimbursable from some of the state agencies.
Great, yeah, that's really helpful. And I know you all mentioned sustainability, and that's a question that's flowing a lot in through our Q&A. So if you all could just talk about how you anticipate sustaining these funding. The question came is, are you planning to use tax dollars or other grant sources? If you could all just talk about some of your initial thinking about how you will sustain these programs and services after the ARPA funding expires.
So for Fulton, we're currently in the process of trying to partner with the state, the Georgia Department of Behavioral Health and Developmental Disabilities, to secure funding for the sustainability of the Behavioral Health Crisis Center.
Yeah, and I'd say for Allegheny, the mobile crisis expansion, we're really looking at an increase in service to sustain, it's already a service that is paid for by Medicaid dollars. So, once we have the staff, those services we're looking at not having necessarily an issue in sustaining. However, with the peer respite, that's where we're experiencing a little bit more challenge and difficulty in identifying how we're going to sustain that. So right now, what we're doing is we're really researching some programs around, our state, but also around the country to find out how they're doing it. And, as Director Foster stated, there's so many rules and regulations around things and licensing that we're really trying to figure out, are there ways to get creative about this? And also, we anticipate that this program will result in a cost savings overall, with fewer jail bookings, fewer hospitalizations, and will really connect people to services to decrease the reliance on the crisis system. So we're going to be looking at those individuals to help to fund this service.
And in Lancaster County, we're working on establishing partnerships, and then the service definition too, with our state behavioral health division, and then also with state probation, but then also some of the services will be reimbursed through private insurance as well.
Great. Thanks for the insight. Hopefully that's helpful for folks on the line as we are all thinking about how to sustain these amazing programs and practices after the ARPA funding. So I'll turn to the Q&A in the chat box. Director Foster, a question came in for you. How is RI's Crisis Now factoring into your crisis response plans? California counties are considering the Crisis Now models, and your thoughts will be helpful.
Yeah, definitely. So we definitely will have to incorporate that as we continue to plan out what our crisis center will look like. But I think for us, just connecting with the state, ensuring that we are an access point for their 988.
Great. This one is to everyone. For those counties with diversion programs, how did you get local law enforcement on board and utilizing the program? Or for the programs that are up and running, how do you anticipate getting them on board and including them in those conversations?
So for Allegheny, this definitely has been, a learning experience. And as I stated earlier, having that no eject, no reject, policy right at the door is important. Allowing officers to show up and have a quick turnaround within 5 minutes or less. We really want to make the experience better for them at the crisis residential and the walk-in centers, as they have, instead of what they may experience at the jail or the hospital. Because if it's easier for them there, then they're going to go there first because they have public safety to tend to. So, just quickly, we have a few programs. We have CIT, which is the crisis intervention team here with our law enforcement. So we take that opportunity to really share with them around behavioral health, needs within our community and the availability of these programs.
Great. Director Hoyle or Director Foster, any thoughts on getting local law enforcement on board?
So we started a pilot program in 2018 called Pre-Arrest Diversion, now called Policing Alternatives and Diversion. We do not actually have a diversion center. Our diversion center is slated to open in January of 2023. However, with the PAD team, they meet the police officer at the location. And so we feel like with the diversion center, it will alleviate the police officer having to remain on site waiting for someone to come to them. They'll be able to drop an individual off. And what the PAD team does is they meet with the police officers during their call down. So when they first show up for their shift for the day, they go in and do a quick overview. Hey, don't forget we're here, PAD is available, constantly educating them on what the PAD program is. And then prior to us actually launching PAD, when we were in the pilot phase, they would meet with different zones to educate them on the service and how to best utilize it.
And in Lancaster County, law enforcement has been on our planning committee from day one. And in fact, they're the ones that provided the call data as to where a lot of their youth crisis calls are coming from, that helped us really determine what neighborhood we needed to put our family resource center in.
Great, thank you for those insights. For a county that wanted to implement something like this, what would you suggest as a first step after you have identified the gap in data? Have you learned any lessons that you could share with us?
From Lancaster County, I would say the number one thing for us was really getting the stakeholders around the table, all the necessary stakeholders, and sharing that common mission and vision around what we were doing so that it was everybody's idea and everybody was being heard as we were putting this together.
I would definitely agree that stakeholder engagement is very important for multiple reasons. And one in particular is to ensure that people are utilizing common language. And then in addition to that, I think a collaboration and partnership with your regional Department of Behavioral Health to ensure that you have buy-in from them to move forward with your planning so that you will be able to create a sustainability model moving forward.
Yeah, stakeholder input would be on my list also as the top priority. So important to solicit that input and feedback, and also to do it ongoing. I would say to make sure that you put a plan in place in which your communities and residents in your community have an avenue that they can continue to provide thoughts, ideas, feedback, and not just when an issue arises and or a new program is opening.
Great. Another question that came in, how have you been able to leverage technology to streamline the crisis intervention process from 911 call to triage police to crisis event location to triaging to appropriate level of care?
Currently, our 911 system and our community county crisis system, they talk, they collaborate, but it's not all one system. So we really are looking at the implementation of 988 to identify opportunities to really make that more of a partnership, and to hopefully, one of our goals would be that a call that may go into 911 that would require a behavioral health response would just get that and not necessarily that police officer initially.
Yeah, I would have to agree. I think we're all excited and waiting for the 988 rollout, because currently you do have multiple systems that do not communicate with one another.
And I would say for us, we recently have looked at other jurisdictions too, as far as how they're responding to crisis calls without the police. I know initially a couple of years back, we had individuals come forward to our mayor that expressed concerns that there were no other avenue available. There was no other avenue available for people to get behavioral health supports in a crisis other than to call the police. And so we reached out to our nonprofits, and they had actually, most of them wanted the police to respond with them to the crisis. So we're looking at different sites now that do that, and we're actually having an assessment completed of our current system.
Great, thank you. Deputy Director Denny, could you say more about the peer run respite, maybe what it is, how it's funded, some of the goals?
Sure. So this is a new area for us. We do have the crisis residential currently, but what we're looking for is a low barrier, non-clinical, peer run and peer led without clinical staff respite for individuals to access, when they're feeling that they need some support. However, they don't necessarily want support from a behavioral health professional, and just would like to talk to somebody who may have been there and walked in their shoes or a similar situation, and just get that support. We're also looking for this to be in areas that are underserved, so that people have access. And I can't say enough about the access, and I'm not sure about, Georgia or Nebraska. I would think Nebraska transportation is probably pretty difficult there, and we don't have the best transportation system here in Allegheny. So access in individuals' communities are key.
Yeah, absolutely. Director Foster, do you anticipate any issues with having the center construction completed by the end of 2026 deadline? Will it be done with 100% ARPA funds? And are there funding from multiple governments or just the county's funding?
So right now we have allocated 17 million towards the capital cost to either renovate or to do a new construction. With the 17 million, we have also asked the state, Georgia Department of Behavioral Health and Developmental Disabilities, to invest 9 million. That way, if we do a new build, we will be covered completely 100%. And then we will also partner with the state on the operational costs moving forward to see if they will fund us for operational expenses for those expenses that we cannot recoup through Medicaid or Medicare. Yes, the facility will be up and running. I'm crossing my fingers. Our end goal is to ensure that we have something open in 2023. So next year.
Okay. Sending all of my wishes and crossed fingers over to you to get that up and running by then. Great. If you all could just talk about what your biggest accomplishments are so far to date. I know you are all kind of in the newer stages of using this funding, but maybe any accomplishments that you'd like to highlight for this group.
I would say for Fulton County, just being able to have this conversation with the State Department of Behavioral Health, to be able to move the county forward, but move the county forward where we're standing in alignment with the state of Georgia's Department of Behavioral Health. That is an exciting moment for me, that we will actually be able to have a behavioral health crisis center within our county that addresses both the needs of adolescents and adults experiencing a mental health crisis and or in need of substance use disorder treatment. So I'm just excited about that. It's a huge accomplishment to me that we're here, that we have the conceptuals, that we're ready to continue to move forward and engage the state and additional stakeholders in our plans around a behavioral health crisis center within our county.
I would agree and say for Allegheny, just being here, as Director Foster said, is huge. And we all know, for those of us who have worked in behavioral health services for years, that we're not always recognized so much, right? So it is great to be able to that the country and others see a need, and that behavioral health, should be right up there with a person's physical health, and maybe sometimes even more important, right? So I think that that's huge, and very excited to do lots of things with some incoming monies that we typically have not had in the past.
And I would say Lancaster County mirrors what's already been said. It's an opportunity to move what we knew was a gap in our system forward. And at the same time, we have partnerships in place that we know this service will be sustained.
Great, yeah, great accomplishments, especially as with the transition to 988, we know that mental health and behavioral health is a priority for all counties, and it's great that this money's being used for those services. Brent, did you have a comment?
Yeah, if I could just quickly, I think I'd be remiss if I didn't jump in quickly just from the NACo perspective on specifically the sustainability piece of this, and how folks are going to continue to move these programs forward after those ARPA dollars have expired. So I do think it's a very key conversation. And so just from NACo's point of view, and one of the things that we're working on in the government affairs team in particular is looking at some of those annually appropriated grant programs at the federal level. So for instance, the Justice and Mental Health Collaboration Program offered by the Department of Justice, which some of you might be familiar with, We're working right now on a reauthorization with a couple of key members of Congress that would expand that grant program to allow for certain eligible uses, including the hiring and retention of staff for 988 hotlines or crisis mobile intervention teams and things like that. So we're trying to piece and parcel through ways in which we can, at the federal level, try to assist in the sustainability of those really innovative programs that have been highlighted here today. So I just wanted to put that out there as well.
Great, thanks, Brett. I really appreciate it. So we're rounding the end of the hour, and so I'd like to ask our panelists, what piece of advice would you give to other counties interested in using ARPA funds for behavioral health programs and practices?
I would say that I think we've, pretty much, discussed throughout, but the most important is that stakeholder input. Also, looking at sustainability and getting creative with the sustainability and funding sources, and looking for funding sources that, we may not have tapped into in the past. People may be much more likely to help support and fund behavioral health. And the last thing I would say is, we're living in this world of uncertainty. Hopefully, I think we might be getting a little bit back to some certainty, but we really need to look at what the impact of COVID had on our service continuum over the past 2 years, and really begin to reevaluate the service delivery system as we knew it in 2019 and as we know it today, and make sure that we're investing our dollars smartly and in the appropriate levels of care. And to do this, we really need to review all of the utilization over the past couple of years in service areas. So that's really key, because, services look different today than they did in 2019.
Yes, I would have to agree with Deputy Director Demi. But I would also add is that, you do an assessment of your community. What are the true needs of your community? And determine where the gaps in services are. This is the prime time to be able to utilize funding that we may not see in the future. I think one thing that has come out of COVID is that everybody's talking about behavioral health. So as behavioral health providers, we know that this has been a long time coming. We're here. Everyone is talking about us and what we do. So how do we make the greatest impact right now, here and now, while we have the funding that is allocated to us to address the needs of our population? So just doing that gaps needs assessment, determining where the gaps in services are. We don't have to duplicate anything that's already in existence and it's good and it's running fine. But we need to identify where are those services that people are in need of, but our particular county doesn't offer it, or it's a distance from where they are to obtain that service. So all about access, making sure that people have access to the services that they need.
And I would echo what's already been said. I would also add to that community engagement and community buy-in, taking the time to go out in the community to potential clients and seeing what they need, what services that they think that the community is lacking. There's been so much publicity over this funding that really taking time to hear the community's voice and make sure that they have input into this, I think, is important as well.
Absolutely. Thank you all so much for this great insight, Director Foster, Director Hoyle, Deputy Director Denny, and Brett. Thank you all so much for all of your wisdom and guidance over this past hour. We really appreciate you joining us and providing just some insight about what your county is doing to support community members with behavioral health needs and conditions. So this wraps up this webinar. The webinar materials and recording will be available on NACo's event page within the next few days, and we will circulate that information via email as well. If you have any questions, please don't hesitate to reach out to me. I'm happy to connect you with our panelists and our speakers if you have specific questions. I know Some have rolled in when we've been chatting. And the next webinar in this series is one focused on mobile crisis teams, and that will be in 2 weeks on March 9th. And we hope you can join us for that. I hope you all have a great rest of your day, and thanks so much for joining us. Bye.
Thanks, everyone.